Okay, welcome to another Zoom call. It is the 17th of August. And as I remind you on every Zoom call, it's just a reminder, just because we have new people all the time joining these. If you have questions that you don't want to wait till the Zoom call, feel free to look on our blog on our website. Now, we don't have this search piece on our member site, but that little search thing right there on the website, you can search for your topic. And we may have created a page, I may have created a blog, I may have created a video over the years that may answer your question, and that will help just you with your question, hopefully. We have a members site. If you are not on the member site, you probably aren't on this Zoom call, so we really don't need to talk about that, but everybody should go and use the member site, if you will, please, to make sure that you see any new information. So we have announcements on the member site all the time. So make sure you look for those announcements. That should be your first go-to. If you have questions and you want to communicate with us, then you go to the member site and you could put in a question on the member site. We have 2 Zoom calls a week, remember, and Zoom call on Mondays at noon, and my Zoom call here that you're on today. So, and then if you do ask the question on the member site, then it goes into the PowerPoint keynote presentation that we're going to get at right now. So here's a question. It was kind of big, so I had to do it in a smaller font. And let's go through it. General question regarding CT scans and how accurate they are. I have had 3 CT scans of the pelvic area now for a colorectal tumor. 2 with contrast and 1 without. I am using these to measure progress. The only problem is that they're very inconsistent. I've had several MRIs done as well, all done since March 11th, 2022. First scan, estimated length 4.7 centimeters. Second scan, with contrast, the radiologist said no change. Third scan, more recently, the radiologist said 6.3 centimeters. Now is 6.3 centimeters, now 6.7 centimeters. We're talking about a 4 millimeter difference there. In reviewing the MRI, nowhere in the summary did they mention length. Per the oncologist, this is very slow growing cancer, so I am suspect that it went from 4.7 to 6.7, and I am sure how they determined the 6.3 in the previous measurement. Maybe the radiologist remeasured the first scan, since this was never mentioned in any of the other reports. This is somewhat frustrating in trying to measure progress with Mike Hunter's clinic protocol. Good news is here were 2 to 3 suspect pelvic lymph nodes. The biggest one was 9 millimeters, now 7 millimeters. Others did not change. So, I've said multiple times that even though CT scans and PET scans and MRIs are the gold standard of measuring progress in masses in the body, at some point in history, should the Lord tarry, we're going to look back and laugh at this technology. So the reason is that you're still looking at not just a 3-dimensional object, you're looking at a multi-dimensional object that is tissue that changes shape and size, possibly on a daily basis, and certainly something in your colon that is going to change when, even with food passing through it, and then you're trying to make an assessment to whether there's progress or not. It is very inaccurate. I mean, if you just think about it from a physical standpoint, you have to argue with the inaccuracy of the test. So what you have to do is kind of take it in gross understanding, meaning like, okay, if it was measured at 4.7 centimeters at one point in time, and it was now 12 centimeters, okay, that's a change. There's obviously a large enlargement. But if it was 6.3 and it's now 6.7, well, what's the variability of inaccuracy in this test when you're looking at a multidimensional object? I mean, you could have been laid in the in the scan a little bit different. Your guts are in a little bit different position. The cancer is in a totally different position. Now you're looking at it completely differently. Where are they measuring from in the first scan compared to the second scan? There's just a lot of inaccuracies. You're really looking for gross changes. So yes, if the cancer hasn't gotten any bigger, well, then it's not continuing to rapidly replicate. Remember, the definition of cancer is the fact that these cells are in rapid replication. And if it hasn't gotten significantly larger, then you got to go, okay, well, at least something is happening, that either cells are dying or there's a decrease in the rapid replication, a decrease in the rate of rapid replication. So it is all good. Unfortunately, it's still considered the gold standard. But what I say is, with every test, you have to measure every test and balance it with other findings. So you look at subjective and other objective findings. So if I had a scan like this, oh, there's not that much change, I must be doing better. But if my symptom pattern in a lot of different areas has gotten worse, my fatigue is worse, I have shortness of breath going upstairs now, my maybe some other objective findings are changing, my red blood cell count is dropping, my hemoglobin is dropping, well, then I would be real encouraged that the CT scan is showing quote unquote positive results if I'm having all sorts of other negative, subjective, and or objective findings. So you balance out any subjective or objective finding with other subjective and objective findings in order for you to gather that information and say, okay, I'm going in the right direction, or I need to change directions in a little bit, change my something to try to move in a better direction. So that's my opinion about any testing, not just CTs, MRIs, PET scans, or blood work, but anything you want to look at. Sometimes a person can feel much worse, but then all the other objective data is showing positive results. And sometimes a person can have very poor objective data, meaning the scan is showing enlargement in every aspect, but the person's like, oh my gosh, my symptoms are gone and I'm feeling so much better. How can this be? Then that's what's called a pseudo negative change, because sometimes when a tumor is dying, it's your immune system is attacking it, and you're getting a lot of inflammatory cytokines and chemokines and just different types of white blood cells that are surrounding the tumor, and it looks larger on a scan, and that's what's called a pseudo enlargement. So that's a possibility too, and the only way you really truly know that is to look at other subjective and objective data. Success report. I wanted to share success. My sister, who is a chiropractor, is a graduate of at least one of Dr. Cutter's continuing education courses on his cancer protocol. I used to teach doctors. Her husband was diagnosed back in March with stage 4 lung cancer and given 4 months to live. Not sure if they could afford the Cutter's clinic, but she introduced me to Dr. Cutter's website around that same time. Their oncologist recommended immunotherapy as a palliative treatment. Also, along with this, they obtained a Rife machine from a colleague and mounted a Tesla bulb above where he sleeps, and ran the standard cancer programs, including the Rife nightly. Also, they muscle tested for various nutraceuticals and combined them for his program. After 3 months, they did a PET scan showing both tumors in the lung reduced in size, and more recently, another CT scan with contrast, and size is now yet again reduced. Needless to say, they're very happy with their progress. So praise God, that is just a super blessing. That's why I just always say I don't think the Rife is a magic wand, but it's just, why would you not try it and add it to your care? Should my husband take the supplements that I have that are antioxidants that I can't take? Say that again. Should my husband take the supplements that have antioxidants during his chemo? Okay, so this is somebody asking for their husband who is a patient. No, yes and no. So if you have supplements that have a small amount of antioxidants in them, I don't see that they're going to necessarily be a big problem during the chemo. Plus, my feeling is if you look at our chemo protocol on our site and on the member site, it talks about just eliminating antioxidants for the 48 hours. So the 48-hour window after chemo. So I'm going to do chemo Monday at 9 o'clock in the morning. I'm done at 11 o'clock with my infusion. I'm not going to start taking antioxidants again until Wednesday at 11 o'clock. So that's the 48-hour window post chemo that you would eliminate antioxidants. If you have a supplement with a little bit of turmeric in it, can you still take it? The argument is yes, you possibly can. There's naturopaths and naturopathic oncologists out there, and there's lots of articles out there that tell people forget that whole thing. You should take antioxidants through, don't you even use a 48-hour window. My point is, and my belief is that, well, I mean, since chemo is a very oxidizing agent, I mean, you don't want to negate the effects of chemo. So I would not take at least high dose antioxidants for that 48-hour window. I want that chemo to work best as possible. So some people believe, because they're just, understand it's not always black and white in all this stuff, right? I mean, there's literally very few things in the practice of healthcare that are black and white. Everybody is different, everybody is unique. Some people do better taking high dose antioxidants even while they're doing the chemo, and it's protective of their healthy cells. And it doesn't seemingly do anything to negate the effects of chemotherapy. And some people, it could. My position is this: you just don't know what's going to work for you. And if you're going to do chemo, then I'd give that 48-hour window. But we've had people that have really, really had horrible effects of chemotherapy, gotten super deathly sick. And then my position might change in that particular case, that it might be better if they continue with antioxidants to protect their healthy cells during that time. I spend quite a lot of time outdoors, and pre-cancer, my go-to bug solution was DEET. Not very good for us, right? Bugs eat me alive, and I'm miserable with bites all summer. I'll be ordering some of your bug spray, but for now, I'm managing the itch with Benadryl and roll-on lidocaine. Any concerns with my itch remedies? Well, any medication you use can have negative effects, right? So I can't really legally comment on those medications, but if you could Google the negative effects of Benadryl, then that would be good. I'd say there's probably a lot less negative effects of something that is a topical. You're not going to have certainly, anywhere close to 100% absorption. So, it's going to stay topical for a large part too. So, but certainly Google those. That would help you understand that. I will say that the bug spray that we use, and we have the recipe online somewhere too on one of our or one of our blog posts, really does work. It's pretty cool. So there's other things that you could do if you're really highly susceptible to bugs. So bugs bite and affect the mucosal membrane, and the effect that you have from bugs is a histamine reaction. It's a mast cell reaction. So mast cells are one part of your immune system that are in the mucosal membranes. And so if you get this horrible reaction to bugs, you're getting a horrible mast cell histamine reaction to bugs. So taking some nutritional antihistamines can be good for you. Think of things like our natural clear hist. Think of things like our clear histamine scavenger. They can be really helpful to calm down that mast cell reaction. People that have HNMT gene defects are going to be more susceptible to bug bites as well. There's other natural things like taking garlic or taking B2, I think it is, maybe it's B1, I don't know, you have to Google it. It is thought to be, it's kind of old remedy for decreasing susceptibility to bug bites. So think of those kind of things too, anything you can do naturally to help ward off your either A, reaction to mosquito bites and stuff, or B, your fact that bugs find you delicious. Can the Gerson diet lower your white blood cell count? If so, what should I be doing to get it back? So my answer to that would be probably not. So the Gerson diet is typically you are juicing, you're taking some good nutrition, you're doing coffee enemas. There is nothing in that that would lower your white blood cell count. One of the best things you could do to stimulate white blood cell count is to do coffee enemas, because you're stimulating the parasympathetics, which are stimulating your immune response. Anything that you're taking for an immune stimulant, which is typically things that we have recommended for your cancer, will help build your white blood cell count. So when a person has low white blood cells, that's a sign of immune compromise. And that could be from a longstanding disease like a cancer that is just beating up your immune system. Very common to have a lowered white blood cell count with autoimmune diseases. That's one sign of an autoimmune disease, is a lowered white blood cell count. But you build it up by using immune stimulants, which are the things that we give you for to deal with cancer. Mushrooms are a great way to build white blood cell, because mushrooms are more an immune modulator. Things like vitamin C, vitamin D is an immune modulator as well, can help balance your white blood cell count too. I saw there's a homeopathic remedy in the store for a contrast dye for MRIs. Is there one for CT scan contrast? Not for the contrast, but for the radiation. So we have a radiation homeopath. We don't have a CT dye contrast, because I don't have any way of getting a sample of that contrast dye to make a homeopath of it. So we don't have the contrast for the CT scan. The last few days, my lump on my breast has been pink and like a goose egg, and has been very sore. Last night, I started a targeted therapy from my oncologist. Does this mean that the black salve is out of the question? I so wanted to get these cells out of the tumor with the black salve and out of my body with the black salve. Yeah, most likely I would suggest you stay with that targeted therapy and do one thing at a time and see if that is going to be beneficial first. Black salve is a big step, and that's a big commitment, and it's not something we recommend for very many people. So I would say let's stay with what they are saying, what they are asking to. Understand, if you have a pink reaction at the cancer, or reddening, a heat reaction at the cancer, that's not always bad. That's an immune reaction. So that can actually be a good thing. You're getting an immune targeted reaction at the cancer. That's what you want. So you want the immune system to attack a cancer. So if you're getting redness, this is where that one blog post about good pain, bad pain, this can be a good sign, even though, oh my gosh, it might even cause pain. So I wouldn't think of this as a negative thing. Today, after I did my foot bath, I realized that I failed to unplug the red and black connectors for the bulb. I switched the toggle switch to foot bath, and the unit seemed to work like normal. But did I do any harm to my unit by not unplugging the bulb? No, actually, you did exactly what you're supposed to do. You're not supposed to unplug the bulb. So do not unplug the bulb when you do your foot bath. Leave the bulb plugged in. So we have some videos on that that explain that. But make sure you leave the bulb plugged in. I mean, if you unplug the bulb, you know, 99% of the time you won't hurt the machine, but you can get an arc between those two things, those two inputs for the bulb inputs. And TrueRife recommends you keep the bulb plugged in when you do the foot bath. Make sure you toggle switch it to foot bath, just like you said, and you're running the foot bath programs. The biggest reason why a person injures their Rife machine is they will run a foot bath program not toggling it to foot bath. So they'll run it through the bulb, or they'll run a bulb program through the foot bath. So they'll toggle it to foot bath. They'll turn on they'll put the foot bath, plug in the foot bath. They'll put it in the water, and they're running not a foot bath program, but a bulb program. You can blow a fuse. That's what you'll do. Worst case scenario, you'll blow the transistor. That's that silver thing that you have two of on the back of your Rife. You'll blow one of those transistors. Usually you have to do it for a period of time before you do that, but those are the most common mistakes on how you'll injure your Rife. Pretty much anything you do to the Rife, short of throwing it out of a 10-story building, is very fixable though. So it's not that delicate that you'll injure it that bad. So is there a tumor marker test for brain tumors? Mike's first MRI following chemo and radiation showed something there, but it's the first scan post-treatments. They don't know whether it's tumor again or from radiation, meaning they're looking at it, good thing that they're thinking this way, as possibly a pseudo tumor. He's feeling more fatigued again, so I'm suspicious that it's regrowth. Unfortunately, there isn't really any tumor markers for brain cancers. I mean, understand that tumor markers can be for any cancers, but if you look at the research out there, you really don't run tumor markers for brain cancers because they're not going to show positive. So there really isn't. That's not a choice. You're kind of stuck with MRI, CT scan for your choices. So maybe follow up with your radiologist about that. I don't know what they're asking you the next step to do, but I had pain in my chest and a dry cough for 5 months. My family doctor ordered chest x-ray. It suggested possible pneumonia and possible metastasis in the lungs. He prescribed a 5-day antibiotic and another chest x-ray in a week. I am taking prebiotic in the evening. If it is metastasis, should I change my regimen? Is a CT scan an intelligent choice or overly damaging? May the King of Kings bless you and keep you. Thank you for caring for us. Thank you for that blessing. First of all, your family doctor did a good thing in ordering a chest x-ray. And I think it was a wise thing to not just jump on the bandwagon and say it's definitely metastasis. You could have pneumonia. So it's probably a correct thing to order an antibiotic. Excuse me. And do another chest x-ray. Let's do an antibiotic, do another chest x-ray in a week. I think your doctor is being very wise. But he's also being very wise saying this is possible metastasis given that you have cancer. Should you change your regimen? Well, first of all, you shouldn't change your Rife regimen because you're still treating a metastasis to another organ. So honestly, I don't know who was asking this question, but let's say they have breast cancer, possible metastasis to the lungs. It's still breast cancer in the lungs. It's not now lung cancer. So you're still running breast cancer frequencies. You're not running now, changing your Rife program to run lung cancer frequencies. Excuse me. Doesn't mean that you wouldn't run other things for your lungs, but it doesn't mean that you might not want to change your nutritional regimen. So it would be wise to get a cheek swab done. So send in a cheek swab, and we can check and see if we need to do any tweaking of your nutrition, because there's different way you might, if there's metastasis to the lung, and maybe we should wait and find out. If there is metastasis to the lung, then we do another cheek swab. Let's just wait on that. There's some different nutrition that can help with lung issues too. Separately, the comorbidities that you'd have with a tumor in the lung. So we'd want to look at that. Are borax and lye safe as ingredients in soaps? I have not done any research on this, and I saw this question, and it was short enough that I read it. And I do apologize. A lot of these questions I don't have time to read until this, till our Zoom call. And that's why I don't always have answers for all of these. And I don't have an answer for this. I would assume that there are probably harmful things in both of those, just because they've been used for a century. Borax or lye to make soap doesn't necessarily mean that they're actually safe or good for us. Mercurochrome was a drug they used for centuries. It's a mercury-based drug that they stopped, I think, not till the 50s, and it was causing, of course, horrible issues. This is something you just have to Google. I'm sorry, I don't have the answer to that. I read the book How to Starve Your Cancer by Jane McClelland. She talks about blocking the pathways to the nutrients of the cancer cells use with off-label drugs. Do you think this is important along with diet and supplements? We have a number of patients that are also doing, this is called the care oncology approach. We have a number of patients that are doing this approach along with everything that we're doing. I don't see anything wrong with it, except that you need to do your own due diligence and Google the side effects of these drugs too. They're mainly fairly common drugs, like using diabetes drugs to decrease blood sugar, using an antibiotic. Of course, that has probably a lot of side effects because it's just damaging your gut microbiome. And there's literally research coming out on a daily basis on the microbiome of the body, not just the gut, that is a component of just about every disease. So there's side effects of these things. I'm sure that there's people that have done that approach with great success, and it's really aided with their cancer. Certainly if my cancer was going in the wrong direction and I'm trying to do everything naturally, I would look at this approach from Jane McClelland as well. So I think there could be a lot of wisdom in that. Oops, I had that question in there twice. Okay, now your questions from your chat. How many milligrams of B17 should I take daily? Well, the answer to that is we didn't recommend B17. You're just going to have to make that decision. Typically, B17 comes in capsules of 100 milligrams or 500 milligram capsules. Understand B17 has a toxic effect as well. Taken in a high dose, it can make you sick. So I would do my due diligence and make sure that you do not take too much of that. I would start with something. I would start with the 100 milligram capsule and work your way up if you do want to choose that. If that's not something we recommended, that's going to have to be something that's going to be your choice. The last while I've felt very weak and wobbly on my feet. I've also felt lightheaded. On Sunday, in emergency, blood work revealed very low readings for potassium, hemoglobin, and blood circulated iron. Iron storage was good. The doctor prescribed slow release potassium, which has brought me in better balance. She also prescribed iron. Later, I thought about the fact that cancer can feed on iron. I'm in a dilemma as to whether the iron meds will feed my breast tumors and make my cancer progress. My tumors continue to grow anyway, despite various interventions. So I think the doctor did a good job at giving you potassium. I think you do need to look at the iron that she's given you for two reasons. Number one, even a good source of iron can feed the cancer. But the iron that is prescribed 99% of the time is ferrous sulfate. And that is a really poor source of iron, and it can cause gut issues. It's not well absorbed, and it can actually have some toxicity issues. I would not use ferrous sulfate. I would not use any prescribed iron. If you're going to use iron, use a good natural source of iron. We have a couple in our store. Secondly, if you're going to use iron, know that there's a catch-22. My iron is low. So when you have low iron and low hemoglobin, it's called anemia. So the anemia that cancer patients have has a name. It's called anemia of chronic disease. And in this case, it's from cancer. And anemia in cancer with cancer patients can be because the cancer is gobbling up the iron, causing the anemia. So then you're kind of in a catch-22. Well, if I take iron, well, then I'm just basically feeding the cancer. But if I don't take iron, I have this anemia, and that is not good for me either, because I have fatigue, I have no energy, I can't get my oxygen to my tissues, because that's what hemoglobin does. So it carries oxygen to the tissues, and it is very important. Iron is a very important component of that. So you're in a catch-22. So one theory is that there's certain nutrients that can follow iron. Artemisinin is one. The beta-glucans is another thing. So mushrooms can follow iron. That's some theories that are out there. So we typically tell you, if you have to take iron, use our iron artemisinin protocol on our website, or if you're already taking Elovia Immune, or you're taking a mushroom, then take it with your mushroom, or the Elovia Immune, or artemisinin. Berberine can also follow iron, so if you're taking berberine, take it with your berberine. But you're kind of in a catch-22. I need to increase my iron, but iron can feed the cancer. What do you do? I mean, you got to make a decision to boost your iron. But certainly if you're going to take iron, take a good natural source of it. It's not going to damage your gut as well. We have a really good liquid iron. That's some herbal components to it as well. And we have an iron ferrous by glyphosate, by glycinate. And that is a double bonded iron to a glycine molecule. That's the way we found in plates. And that is our reacted iron, or it's called our clear iron. So that's the iron that I would take. Is aspirin okay for the days I have pain, or is it harmful? I am so sorry. I have a scratchy throat. Well, like any medication, it can have its negative things. Just because it's an old medication does not necessarily mean it's a goodie. Oldies are not always goodies, right? So I can't legally tell you to take aspirin or to not take aspirin, just like I can't legally tell you to take, any drug that's out there. Aspirin does have the side effect of increasing the possibility of bleeding. So if a person is taking aspirin, a lot of aspirin, especially, they're going to have a greater chance of developing, stomach issues, bleeding issues, blood thinning issues, which can be maybe what they're shooting for. So it depends on exactly, what is going on with that person. Maybe they do need some blood thinning issues, and that's what they're going to choose to take. Of course, any of the other drugs, like over-the-counter pain medications like Tylenol and Advil, can have, maybe even worse issues. So that will have to be something that you'd have to take up with your medical doctor from a legal standpoint, or do your own research, and maybe aspirin is the best thing for you and the least of all the bad things that are out there. Um, Other things that you can do for pain from a natural perspective is, you start with the flavonoids, the curcumin, the resveratrol, the green tea extract, the white willow bark, the boswellia, the stingy nettles, things like that. Well, those certainly are good for milder amounts of pain, lower grade pain, because what they do is they decrease inflammation, and often pain has an inflammatory component. The good thing about those things is they're pretty much good for everybody, and you really can't OD on them. So the bad thing is they aren't really effective. They're certainly not as effective as a medication for higher levels of pain. When the only thing that can work from a natural perspective for a higher level of pain, maybe like a use of THC marijuana, but then that has other side effects too. So it's not legal everywhere, and it can make you really loopy. But a person with constant pain, that could be an option as well that doesn't do well with pain meds. So hopefully I answered that question for you. Some days I get started late with my supplements, which then pushes all of my doses back. I understand the importance of rest and recovery while sleeping. What are your thoughts about taking supplements close to bedtime? Is it too hard on my liver when it's supposed to be resting, healing, detoxifying? Ideally, I wouldn't be wouldn't be in this situation, but if it happens, would you say to skip the dose or to take it? Um, that's a good question. There isn't anything wrong with skipping a dose, especially if, so I would say it really depends on the person. So if you feel like it's going to give you a tummy ache because you're not taking it with food, you're taking it right before bed, and or if you feel like it's going to keep you awake in any way, then I would say skip the dose. If like, no, that's not an issue at all, well, then you could certainly take it too. So there's an entire concept of pulsing supplements that I've talked about dozens of times on these Zoom calls, and I'm pretty sure I have a blog post about it. There can be benefit to taking a day off your supplements just to kind of give your body a rest, so that there can be benefits to that. So there certainly isn't a negative of taking an evening off. So I don't think there's anything wrong with skipping the dose. Any other questions? Nothing. Okay, well, with that, we'll bid adieu and hope your day goes well. Looks like we're supposed to get some rain for the next couple days, which is well needed as well here in Wisconsin, Minnesota area. So I pray that you guys have a blessed day. Remember to continue to add your questions to the pages on the members only site, and keep looking at the members only site because we're updating, changing, tweaking improving as best we possibly can to make our services as appropriate as we can to everybody. With that, I'll be praying for you, and we cherish your prayers for us. You guys have a blessed day. Bye-bye.